Again, for those who are just joining in, please go to menti.com and use this passcode 60863038 and just type in the chat. Type in as many words as you can. You have up to 5 options. Just type in what comes to your mind when you think of the changing climate and health and how the changing climate affects health. And we can already start seeing some of the ideas or some of the thoughts that you're sharing. Food, possibly mental health, breath, possibly clean air, water, community, and these are very good responses. Please keep them going, and we will certainly be coming back to this, and we will use part of this word cloud to also enrich the discussion we will be having this morning. Again, I welcome you to the session. This is a breakout session. It's on technology advancements or innovations for global health, One Health, and climate change. We have 3 speakers today, and I'll ask them to just briefly introduce themselves. We have Jackie Kisache from the Medical Concierge Group. Jackie, just a brief introduction.
Good morning, everyone. I hope you can all see me and hear me properly. My name is Kisache Jacqueline. I work with the Medical Concierge Group. It's a telehealth company innovating in the digital space, especially to give health solutions. And I'm very happy to be here. This is a germane conversation that is long overdue, and I can't wait for the ideas that I hear today. Thank you.
Thank you very much, Jackie. We have Rahim Kebe. Rahim, brief introduction, please.
Rahim, yes, are you okay? I'm Rahim Kebe, Council Director of SHISU. SHISU is a USAID project implemented in Burkina Faso. So I'm happy to share with you the experience that we have in implementing the One Health approach in Burkina. Thank you. And I am, as you will understand, I'm not fluent in English. So I am assisted with my colleague, Nicole Stock, to help to translate what I'm saying. Thank you.
Thank you, Rahim. And we have Barbara Maz from Pathfinder. Barbara.
Hello, can you hear me?
Yes, we can hear you absolutely well.
Terrific. Well, I want to say thank you. Thank you very much for the conversation we'll have and to inviting me. I'm coming to you from COP26 here in Glasgow. And this is certainly a marathon and not a sprint. And this conversation about how climate and health are connected seems to be the first time where we're noticing that here. More to that soon. For my personal introduction, I'm Managing Director of our empowerment funds at Pathfinder International. We work in 17 countries in Africa, as well as South Asia. It's particularly exciting to see this conversation take place because I've been part of the movement around climate for a long time, but now really listening to those being affected on the front lines of climate change, with drought, with food scarcity, with water issues, and also, of course, storms, floods, hurricanes. There's so many ways that climate is being manifested. So it will be very interesting to see and listen to sharing ideas today. So again, Barbara Mers coming to you from Glasgow, and it's such a pleasure to be on this panel with you all.
Awesome. Thank you very much, Barbara, and very glad to have you all here. We will go ahead and start with Rahim. And what we will do for now is we will give each of the speakers about 5 minutes to share about their work in this space of climate and health. Rahim, please do go ahead and tell us some of the One Health work you're doing and how it plays into the discussion that we are having around the intersection of climate change and health.
Okay, thank you. I'm going to share my screen. Are you seeing my screen?
Yes, we can see your screen. Thank you.
Okay. Okay, thank you. As I said, I'm the chief of party of CHISU in Burkina Faso. CHISU is the USA funded project for the strengthening of the health information system in Burkina, and in particular the disease surveillance system with the One Health approach. Let's say Burkina Faso, like most African countries, are in the process of implementing the multisectoral approach to fight against a major epidemic in accordance with the recommendation of the Global Health Security Agenda adopted in 2014. The Ebola epidemic, which occurred in Guinea, Sierra Leone, and Liberia in 2014, further reinforced this understanding of the part of zoonosis in the occurrence of human disease, and especially the need to see human health in a global way, therefore in correlation with the environment. And the One Health is an approach which the health animals, the health of human, and the health of ecosystem are interconnected and independent. So scientists attribute 60% of infectious diseases in humans to be of animal origin, and 75% of emerging diseases are also due to zoonosis. So One Health information system was launched in Burkina Faso to create a comprehensive and effective response to zoonotic and key human health. Yes. So for the first time, information on human and zoonotic data were integrated and linked in the information system with your other sector as the environment sector. So to mark the start of the One Health approach in response to epidemic in Burkina Faso, the government first established strong leadership by setting up an institution to coordinate this approach. First, there is a national One Health Council chaired by the and then a technical secretariat which coordinates the representative of 5 ministries involved in this approach, and also 7 thematic commissions, as well as the One Health committees at the regional level. As you see, 3 DHS2 surveillance databases have been set up, one for each of the One Health sectors. Then from an interoperability layer, a 4 common database makes it possible to collect aggregate data from the sectoral database. So for the first time, information on human and zoonotic data have been integrated and linked to the information system of human resources on animal environment and climate change. So as you can see, data is entered at the districts of in the sectoral database and goes up according to the information cycle for each sector up to the central level. So decision makers have access to the database and can also receive notification by SMS or by email. So as a result of these interventions, the One Health Coordination Committee is functioning and meets regularly to discuss about health events. All diseases under surveillance in Burkina Faso, either in health, human health, animal resources, and environment sectors are monitored, including priority diseases. The One Health electronic platform has been adapted again to ensure the response to COVID and allow real-time notification, access to the test results, to monitor the vaccination data, and even to follow up supplies data. And this system has also become the model and building block for the deployment of other systems and tools needed by the country by the use of the interoperability layer to access and share data between systems. And the One Health actors are also able today to lead investigative mission of health events. I wanted to mention again this example of collaboration with the One Health approach that we consider as a success story. In July 2021, significant fish and cattle mortality was reported in the Mohon River. Mohon is one region in Burkina Faso. And thus, the One Health Technical Committee decided to conduct a joint investigation involving the Ministry of Health, the Ministry of Human Resources, and the Ministry of Environment. As a result of following survey of local residents and sampling of water and dead animals, the cause was identified as due to cyanide dumped in the Mohon River by the artisanal miners working in the area. And this result was confirmed by laboratory analysis. So to conclude, from this lesson learned, we can conclude that it's possible to make interoperability between people and processes, even from different sectors, in order to achieve efficient results in the response to the disease that affect the world today. And the COVID pandemic reminds us of the need for this multisectorial approach. So thank you for listening to me.
Thank you very much, Rahim, and especially sharing the One Health approach. And we've already seen how vital it is for us to really monitor what is happening within our own environment, what's happening within the animal population, because there is interaction between these three sectors: the environment, the animal population, and the human population, that results into several diseases moving from one population to another, and potentially COVID being one of them. So it's very good to see that in Burkina Faso you have this system that is integrated, and you're getting all this data and using it to inform or to help policymakers come up with various policies that can ensure good health for everyone. I want to now ask Barbara to share about the work that Pathfinder is doing as well around this area. Barbara?
Thank you, Charles. And I couldn't agree more. One Health is exactly the most beautiful phrase. And thank you for that presentation. I do absolutely learn from each and every country in the data. One of the themes here at Glasgow is accountability through evidence, making sure that we have the right set of tracking and that we are spending the time to really come together and share lessons because what might seem to be an spontaneous, unique occurrence is actually linked in a systemic way across the planet due to changes in our temperature and atmosphere due to climate-induced warming. I too have just a few slides to share, and let me simply give you a little bit of a background for this conversation around what Pathfinder is doing. So let me know if you can see my screen. We work at Pathfinder, as you might know, across 17 countries, mostly with sexual reproductive health and rights for women and their family. We have family planning consultation, as well as HIV counseling, visits, but we work so closely with community health workers. We work with maternal health, as well as children, adolescents, and youth. We believe, based on the many decades of work, and we're learning more and more, how centrally the role that women play as building the vital resilience in communities. We know that the climate crisis exacerbates insecurity through many of the things people have spoken about, and as the Menti poll that Charles gave us will reveal, the drought, food security, air, more vulnerable when climate actually is also increasing migration on the continent, the gender-based violence, as well as lacking the kind of progress we've seen in education rates, that can slip back as well. So we think that this is a time for strategic investment. And as you all might know, in the Paris Accords, this was the time where there was a promise for $100 billion a year to be dedicated to countries from those that are in the West, where a lot of the emissions started, to come to countries that are facing adaptation challenges. For the first time at COP, this promise is coming real, and we have to hold policymakers to account. With Pathfinder, our approach is, of course, really empowering women through making sure in a rights-based way we meet the unmet need for contraception, that we invest in girls' education, and that we support women's engagement and their voices in local resilience planning. We partner in Tanzania, for example. We've worked a long time, over a decade, with conservation organization, Jane Goodall, the Nature Conservancy, even the Frankfurt Zoo. Increasingly, we're also doing more work with advocacy, and we've done some research lately, partnered up with the Institute for Health Metrics and Evaluation, looking at the impacts of extreme heat on communities, particularly how women and households will manage and what potential interventions, prevention is possible. The forecast on this really goes to show in the next years, we are facing extreme amounts of heat, particularly in Africa and Asia. We want to let you know that we also have some great projects on the ground. We're working in West Africa, in Niger. We're working in East Africa, Tanzania, Kenya, Uganda, but we would very much look for increasing opportunities to work in radical collaboration. I could go on, but mostly I just wanted to share we're developing our theories of change. We're working with communities. We're very excited for this work, but we know that it's new. And we know that others are also going through the challenge of how do we do our best work? How do we come together across our silos? So let me just start with those comments, Charles, and hand it back to you.
Brilliant. Thank you very much, Barbara, and especially raising the issue of gender. And we already know that women are disproportionately affected by climate change, and definitely building resilience for women, but also educating them, creating awareness about these issues is such a vital component of this discussion, but also vital action to take during these times when we see the effects of the changing climate on various populations around the world, and especially in sub-Saharan Africa, in Asia, and potentially South America, which are definitely the developing economies, developing countries. And we've seen as well technology come into play in the aspects of climate and health, but also in delivery of healthcare and ensuring global health for everyone. So I just want to invite Jackie from the Medical Concierge group to share with us some of the work that they're doing there, definitely already knowing that the Medical Concierge group is a leader in tech for health. Jackie, please.
Thank you so much, Charles. Thank you, Barbara, as well, and Rahim. I think I'll just hint on a couple of things that they mentioned as well to just especially highlight the work we do. Barbara spoke of getting evidence for the impact of climate change to health. We're realizing that a lot of changes within the climate are leading to different health outcomes and adverse health outcomes at that. We're seeing burden of NCDs increasing highly. We're seeing more and more zoonotic diseases crossing from animals to the human population. And the work we do basically at TMCG is that we give evidence for that, because we realize that the people who are greatly affected in such issues are marginalized communities. So we look for digital solutions that we can be able to reach those communities and get their stories, to get the evidence, to get the numbers, to see how the climate change crisis is actually impacting them. So issues like, diseases like COVID-19, especially because it was termed as zoonotic disease earlier on, just giving people a platform to explain themselves, to be able to give evidence, the fact that how they are impacted in different ways, as well as different crises, especially in Uganda. We have looked at Ebola, which is also considered one of the zoonotic diseases. So what we do is that using our technology, using our digital tools, we provide evidence for that, in the sense that we reach out to people, give them care as well, but as well just collect that data that can be especially used for policy change and influencing certain systems, so that later on, or actually starting from now, we can deal with the climate change crisis and how that's trickling down to human health as well. Thank you.
Yes, thank you very much, Jackie. And you ended there with, again, a theme that has been running through the sharings that the other speakers have done. That is gathering data, gathering information, gathering evidence. And one of the missing gaps that we've seen, and as Rahim also mentioned, that our goal is really to bring this multi-sector approach to addressing the current predicaments or problems that we experience in health. And the stumbling block there is, how do you then translate the research, the evidence that you've generated into policy, into decisions that will impact health? And I just want the speakers to share with us any lessons, any experiences you've had with working across sectors, breaking the silos. Of course, Rahim shared this image of environment, animals, health, which tells us the Ministry of the Environment, possibly the Ministry of Agriculture, the Ministry of Health are coming together to talk to each other or to listen to each other. I just want you to share any insights, any experiences with this kind of multi-sector approach. I will go back to Rahim first. Yeah, thank you.
Okay, thank you. I need a small translation of your question.
Nicole, could you help with
Yes, I'm here. Good morning, everyone. Oui, Dr. Kabe, donc il demande comment traduisez-vous la recherche et les politiques qui ont un impact sur la santé. Donc, vous avez donné l'exemple de l'interopérabilité et des données des différents domaines, comment on peut traduire ça sur la santé. Donc, si vous voulez donner un autre exemple.
Disons, so I'm going to give the response in French. Maybe Michael will translate it in English.
That's all right.
Okay, thank you. Disons, les autres exemples que nous avons de l'interopérabilité ou en tout cas de l'approche multisectorielle, c'est surtout au niveau leadership et gouvernance. Au Burkina, par exemple, on a commencé par mettre en place un processus de gouvernance qui réunit l'ensemble des acteurs multisectoriels au niveau du pays. J'ai cité le comité de coordination One Health. Et donc, ces acteurs, aujourd'hui, sont en capacité de conduire, disons, des missions d'investigation, comme on a vu dans le cadre de la mortalité de bovins. Mais il y en avait eu d'autres cas aussi dans d'autres régions. Il s'agissait disons, de mortalité en ce moment de bovins. Bon, ça s'est passé dans d'autres régions. À l'époque, le pays n'était pas tout à fait encore équipé pour faire des investigations conjointes, mais avec la seconde investigation, l'appui de Chissou avait permis, n'est-ce pas, de conduire ce genre de système. Merci.
Merci, Dr. Kebe. So for everyone, we have other examples of multisectoral approach, mainly in governance and leadership in Burkina Faso. We are bringing together stakeholders, and the One Health Technical Committee is a good example of bringing together actors on the ground from different domains. The joint investigation that was presented during Dr. Kebe's presentation is a good example of collaboration, which has an impact on people's health. We had other cases of cattle that was found dead in Burkina, and this was at the time when there was no strong interoperability, and Chisu's support enabled a second investigation, a joint investigation that had a strong impact on health in several regions in Burkina Faso. Thank you.
Thank you. Barbara, any experiences to share around multi-sectoral collaboration, how important it is, how important it is in the work that you're doing, and any lessons that you've learned?
Thank you, Charles. Thanks all. Yes, intersectional work requires multisectoral approaches. I could not emphasize more how much this challenges all of us to climb down from our silos, to reach out to one another across domains. That's a challenge that exists, of course, throughout every layer. It exists how we work on the ground, how ministries are set up, how funders typically separate out the streams. And so this will require transformative change. But we've seen it work. You know, we've seen this work in Tanzania. And frankly, this is actually coming from the communities. They are demanding that we work in these new ways. Our experience, to share a brief story from Tungani, near the Lake Victoria Basin, is the work that the community itself 10 years ago, when a conservation organization approached them to simply work on the question of fish in the lake. What was happening? It was being overfished. The resources were not as plentiful to feed the communities. And yet, when that work started, the community members themselves said, actually, we don't live a single issue life. We don't live lives that just happen related to the food on the table. We're also concerned about the future for our children. We are concerned about the health and how long it takes us to access our healthcare. We're concerned about the difficulty to access contraception and to be able to have choice and voice around how and when and the number of children to welcome into our families at the right time. All of these are so interwoven. You start with a fish and you end up having the story of all of the concerns around how a family might be looking at their future and how the choices today impact what exists tomorrow. And that, I think, is a lesson for all of us, with real humility to stop and say, are we doing the best? Are we listening most closely to the communities where we work? And how can we take the courageous steps to actually reach beyond the boundaries of our expertise, to bring in others, to welcome collaborations, new conversations? So yes, I really do believe that's important. And it's not without challenge. One of the things we at Pathfinder have discovered is that, of course, this evidence base that Charles and all of our speakers have pointed to, typically these can happen on different timelines. When it comes to the environment or to animal health, those can be different timelines from the kind of metrics we're used to being able to record and understand from a human health perspective. So timelines on restoring the fish of the lake to be plentiful with fish, those can be different timelines. And I think it's really important to early on really have those conversations about what evidence, what metrics, what are we recording. You'll also hear a lot of conversation about resilience. That does not have a shared definition. So as we come into partnership to listen to community members, to really listen to local government, what would a resilient community look like to you? Because I think these solutions are quite hyper-local. The challenges that are faced by each community by climate are as different as the geographies across the land, as different as the ecosystems where we live. And therefore the solutions will also need to be attuned to that environment. So Charles, to your question, absolutely, we need to work intersectionally. Absolutely, communities are demanding that of us. And we have to absolutely be real about the challenges and step up to that. Thank you.
Thank you very much. Jackie, any comments on this?
Thank you so much. Barbara has put it really greatly, and Rahim as well. So one of the challenges we face, especially in our healthcare systems, is that we work at the end of the challenge. We usually address the problem at the point when the patient is in the hospital. So we need to move away from just offering healthcare at the end and look at it from a bird's eye view, looking at it from preventative means. And then when we look at that, then we'll definitely see all these intertwined issues that will ultimately help us to work better in different sectors that we work in. But for that to happen, as we mentioned, evidence has to be there. And it's quite unfortunate that a lot of times the evidence we collect, as I said, is at the end of the discussion, at the end when human health is being impacted. But what about we are intentional about getting metrics and how climate change is changing the fish in our lakes, or the flora, or the animals within our communities, how there's increased transmission of diseases from animals to humans. So we need to look at all those aspects and engage every sector. But for that to happen, we need to be really transparent with all the evidence that we have, with all the data that we have, and look for means to be able to work together for the benefit of the population.
Thank you, Jackie. And just to encourage the other listeners, if you have any questions, please feel free to type them in the chat. Or if you have any experiences from your own work that you would want to share, please just either send me a message or just put up your hand. There is an icon for putting up your hand, and I'll ask you to share some thoughts and contribute to this discussion. And I just wanted to go back to the issue of creating awareness, and because this is really imperative for behavioral change. And if we are to achieve some of the targets that have been set for us to see the world in a more sustainable trajectory, it is going to need or require a lot of behavioral change at an individual level. The challenge with the environment and climate, and it's the same with the non-communicable diseases, is that people do not see these effects in the short term. At Tree Adoption Uganda, we plant trees, for instance, and we know the advantage of this, the environmental modification it does, improving air quality, etc., taking pollutants out of the atmosphere and therefore reducing the propensity of people suffering from ailments from their respiratory diseases, respiratory systems and all. But how do you bring this message close to people for them to understand these seemingly abstract concepts and ensure that it changes their behavior? How best should we communicate with populations, or how best should we communicate with communities? What tools or what can we tap into? What networks can we tap into? I know community health workers, for instance, have been very helpful in other global pandemics, HIV, etc. How do we integrate those with proper messaging to improve or create more awareness in the communities? I could start with Barbara for this. Any thoughts?
It's a really, really good question. Community health workers, I always put at the very top. They have such a pulse on how communities are doing. They're so trusted often, and they're often overlooked and quite neglected when we think about important behavior change agents. I would also like to encourage us to really think about, as you point out, the education required to have people understand this might not be sudden change. This might not be overnight success. It will really require tending, and to use the metaphors of the world, like the natural world shows us when you plant a seed, it doesn't yield fruit the next day. It requires nurturing, cultivating, water, sunshine. And I think that all of those elements are just as central to our human health. And when our air becomes polluted, when we are too often locked in our houses, I would say much of the pandemic has shown that it's important to encourage people to spend the time outside, to be active, to have be in their bodies. I also think there's something really interesting about community engagement here and mental health. And I was just going to put a question in the chat, Charles, to you, because I feel like you have some behavior message through Tree Adoption Uganda with youth in Africa, where you've been learning and listening for years about what's really working, what is fun, what's engaging, what motivates and inspires, and also, what areas create people to have despair or dystopian views of their future. I think it's really important to have positive frames of what's possible, since this is such a pivotal decade in the solutions for climate change. I'd love to hear from you. What and how are you seeing youth respond? Because frankly, we should really be taking the great lessons from them.
Certainly, I will definitely take that and share about that. Let me first ask Rahim to share if there's been any work they've done with communities in Burkina Faso and any lessons or insights from that, and especially if they've engaged community health workers in any way. Rahim.
Yeah, thank you. And again, I'm going in French. Disons, la communauté occupe une place essentielle dans cette approche multisectorielle One Health, d'autant plus que elles sont les premières victimes des changements climatiques, aussi de la dissémination des maladies. L'exemple que je viens de décrire tout à l'heure sur la mortalité des poissons dans le fleuve du Mohon au Burkina prouve à suffisance que la communauté est la première victime. Parce que généralement, ces communautés villageoises vivent de pêche et si les poissons sont intoxiqués dans le fleuve, donc ça impacte évidemment le quotidien de ces communautés. Mais dans l'approche que nous mettons en place pour justement associer la communauté, nous mettons en place ce qu'on appelle du Event-Based Surveillance, c'est-à-dire la surveillance à base où les acteurs communautaires eux-mêmes sont informés, sont formés à identifier des événements inhabituels aux différents points de prestation. Mais l'originalité de cette pratique que nous faisons, c'est que c'est un travail multisectoriel où les communautés à la fois de la santé, les communautés qui relèvent de l'environnement, les communautés qui relèvent des ressources animales travaillent ensemble pour remonter les données à travers les outils que nous leur donnons. Donc, pour ne pas être long pour la traduction, Nicole, s'il vous plaît. Merci.
Merci, Dr. Kevin. So communities are essential in a multisectoral approach, especially because communities are actually the first victims of climate change. The example that was brought during the presentation about the joint investigation around dead fish proves that, in fact, community is the first victim, especially if this community lives out of fishing. The approach we support is an event-based approach, which involves the community from start. And it's innovative because communities working from different domains collaborate from the start to generate data that will inform policymakers. Thank you.
Thank you. Jackie, do you want to add any thoughts to this?
Yes, please.
Yes.
So I just wanted to communicate the importance or how germane community health workers are. A lot of times when we are establishing policies, that information or those policies are usually enforced coming down. I truly reckon it should be ground going up because these individuals know what would work based in their communities. So for such an issue as this that requires great behavioral change, I think communities need to listen to these stories in a language that they understand. Stories need to be told from their perspective. We might have evidence of what's going on, how this could eventually trickle, the ripple effect that it would have. But at the end of the day, communicating this to the different communities would require us to understand the nuance that they live in. And for that to happen, I think community health workers are a great influence in such a space so that they can be able to convey this information in a language that the communities understand. Yeah.
Brilliant insight. Just to touch a bit on Barbara's question, and which is also very imperative discussion, and that is how the changing climate is affecting young people. Of course, starting from the positive, we've seen young people respond in various ways, or young people take action in various ways to try and abate or mitigate various effects of climate change within their own communities. but certainly they are being affected in numerous ways. And for us at Tree Adoption Uganda, one key effect, especially in the rural communities, knowing that Uganda is a largely agricultural society and a very young society with a very huge percentage of young people or youths, majority of whom also have families. And in some of the rural communities where we've worked, we've seen reduced productivity on the farm. Majority of them are already subsistence farmers. They have very little to sell off to earn an income, but also what they can produce from their farms to feed their families is increasingly reducing. And what that translates into is one, malnutrition for young children, some of whom are parented by youths, but also it is despair because the only source of livelihood being agriculture, not performing well, having reduced yields, etc., drives these young people to desperation. And usually the only choices they are left with are either to migrate to urban centers where jobs either do not exist or they do not have the requisite skill set to acquire the jobs that they have. And you find them ending up in the slums, ending up in crime, ending up in really dire situations that affect their mental health. And so it is a cascade of several factors or several issues happening along that cascade that brings people to this predicament. And secondly, in the urban communities, we work in urban slums, trying to build resilience around the impacts of climate, especially flooding. And we find that the majority of the people that are affected are actually young women, either because they're the ones that stay at home, they have to look after the family. When you have heavy rains, they have to move the water out of their homes. And so they're more prone to say waterborne diseases because a lot of this water is not really clean. And they are more exposed to these effects. So definitely young people are doing quite a good job as advocates, but as also actors, but they are very, very impacted by the changing climate. And then I want to turn the question again to ask you, Jackie, Rahim, and Barbara, how are you engaging young people? How are you supporting young people in your own work to ensure that they're either resilient or they are prepared or they are coping with these various impacts that we see young people experiencing? And I know those ones that I've touched around nutrition, around waterborne diseases are just a nip of the iceberg, but there are potentially several other challenges that young people are facing. Jackie, any programs, any activities you're doing at TMCG that are directed to young people that are supporting young people and leveling the playing field for them to give them an extra push, either to access health or to improve their livelihoods?
Definitely, definitely. As we've spoken about it, climate change and the changes that are happening globally everywhere trickle down to our health. And a lot of times without information, people don't understand those changes. People don't understand what is affecting them exactly. So as I said earlier, I work with a telehealth company. So one of the projects that we usually have is dissemination of health information. Okay, so we do this by using SMS, where we continuously send out health information to people, to the youth especially, and especially marginalized communities that would ideally be neglected and where the disparity of healthcare needs is really evident. So we do so by sending in SMS messages, encouraging health information that seems rather obvious, but isn't too many. As well, we have a couple of hotlines, okay? Toll-free lines where people call in for health information. And it's really necessary for us to explain to them why all these changes could be happening. Explaining to a mother why their child is malnourished, and explaining to them how then they can, within their means, even with the changes that have happened, that they can provide the best care possible for that child. So we do get involved in such issues, and I am greatly impressed by the strides we've taken to disseminate as much health information to the youth as we possibly can.
Rahim, any examples of work you're doing with young people in Burkina Faso?
Okay, here in Burkina Faso, we work directly in the domain of information system, which involve health actors and other sectors. But the impact of our intervention on the community is in component is evident. So that include children. So I think, yes, what the work we are doing impacts the lives of children. Thank you.
Barbara, any thoughts?
Thanks, Rahim. Yes, let's talk about youth for a second. The demographics of our world. There are 1.8 billion young people in our world today between the ages of 10 to 24, and yet they're not spread out equally across the globe. In the 17 countries Pathfinder works, mostly in Africa, as well as South Asia, there are over 600 million young people. So the area where youth exists, and where I happen to think the real power of solutions, we call them solutionaries, exist, are in these countries, but we have to work in different ways. With Pathfinder, for decades, we've been committed to adolescent and youth sexual reproductive health and rights. And in the design of the programs, more and more, my great colleagues in this area are really ensuring that we're incorporating youth into the design of the programs. I think what's terrific is to hear Jackie say we're reaching out with new technologies, like using SMS, Jackie, to reach them. I really appreciate, Rahim, how you're talking about in Burkina, really tapping into what specifically culturally exists and how we can reach youth where they are, meet them where they're at. And that's also true in our programming. So of course, this is rights-based work that Pathfinder does. And in order to do that, I think we're also learning more and more how to incorporate youth voices into the design and implementation. I see there's a question in the chat. So Charles, this is, how do we address cultural norms with respect to adopting and implementing One Health? It feels like an approach Rahim, question Rahim might be able to take on.
Yes, thank you very much, Barbara. Yes, Rahim, we have a question on cultural norms. Any thoughts on this? The question is in the chat, and it says, how do we address cultural norms with respect to adopting and implementing the One Health approach? Miko, could you please translate that for Rahim?
Sure. Donc, Dr. Kebe, la question est comment on peut adresser les normes culturelles quand on parle de l'implémentation de l'approche One Health.
OK, merci. Je crois l'apport culturel dans l'implémentation de l'approche One Health, elle est primordiale. Je la vois dans deux aspects. D'abord, au niveau institutionnel, comment amener les acteurs qui ne sont pas du même secteur, qui ne sont pas dans le même domaine, à travailler ensemble. Je crois que culturellement, ceci est important à signaler. Je vais revenir là-dessus tout à l'heure. Et aussi, l'autre aspect, ce sont naturellement les cibles de nos interventions, notamment dans les communautés. C'est-à-dire, on amène là aussi des acteurs qui sont dans des domaines différents, les acteurs communautaires. Si vous prenez ceux de la santé, on les appelle ici les ASBC, les agents communautaires. Et puis, dans le secteur de l'environnement, vous avez des pisteurs, des gens qui vont dans les brousses pour suivre les animaux sauvages. Et puis, dans le secteur des ressources animales, ce sont par exemple des vulgarisateurs villageois qui font les vaccinations des volailles. Donc, tout ce monde, culturellement, ne travaille pas de la même manière. Donc, le véritable enjeu, c'est comment amener tout ce monde à pouvoir collaborer. Donc, l'exemple étant donné au niveau supérieur, donc au niveau central, avec ces comités de coordination, impacte les autres acteurs qui sont en aval, donc qui les amènent à collaborer ensemble. Vous pouvez traduire, je vais revenir sur les autres aspects liés au fonctionnement des acteurs et leurs différences au niveau central. Merci.
Merci, Dr. Kebe. So there are two levels of challenges. One is at the institutional level, and the other one is the community level. At the institutional level, one challenge is how to bring stakeholders from different domains work together. And at the community level, we have community health agents who work in health, and there are other agents who work on monitoring fields, and others who work with animals. How do we bring these agents at the community level together? What has been working quite well is engaging the technical working groups at the central level who facilitate collaboration. I think there is a second part of the response, Dr. Kebe.
Oui, je disais, l'autre volet de la question, bon, je vais tenter en anglais. So in the One Health context, sometimes it can be difficult to get all these stakeholders in the central level aligned on the same solution because of the reluctance that there could be to share data between them. The issue of share data access is very, very sensitive. And this is why I think that the approach of creating multisectorial coordination bodies is important, and finding a consensus of the data to be shared is also essential. So in Burkina Faso, for example, the shared data are those of priority zoonosis only, defined in common agreements with the different sectors of One Health. Also, let's say the data platform puts in place are first of all sectoral, so accessible only to users of the sector concerned. So interoperability make it possible to share this data only on the 5 zoonoses. So you see, so putting the different sector in the coordination committee to ensure governance and leadership, I think it's very essential. And the other thing is, in generally, the Minister of Health has much more means and tools for data management, for example, while in other sectors such as environment, animal resources, the tools are very limited. So particularly in the domain of disease surveillance, so it's important to take this into account, yes. Thank you.
Thank you very much, Rahim, and also Nicole for helping with the translations now and again. Well, we have young people attending today, and young people definitely always have the ability to express themselves. I know Simon is on the call and would want to share something. And I encourage other young people and other participants who would want to share something to.
Thank you, Dr. Charles. My name is Simon Peter Okoth. I work with Pre-Adoption Uganda. And as Dr. said earlier, we have been in the team that plants trees, and mostly we plant these trees in rural communities as a climate action initiative. But one of the main challenges that we've got as young people is how do we effectively communicate to the people in the rural communities about climate change in relation to their health. And it's going to be more of a question because it's a challenge in relation to traditional and religious beliefs that most of the rural communities, the illiterate communities that are mainly affected by climate change do not actually know what is happening. They still have belief that this is not just changes in climate pattern, but they believe these are challenges caused by either the gods are maybe not pleased with some of the things that have happened. So it is difficult to explain to them that it is human activities, or it is this and that is happening, and this is what we need to do to address this. So the challenge here is how best we communicate with them and make them know that this is a reality. We do not need to, for example, sacrifice to the gods to solve this challenge. How best we handle that without necessarily compromising their traditional beliefs. Thank you.
Thank you very much, Simon, and definitely a very good issue to raise there, which again takes into account what Rahim was mentioning about cultural norms and cultural beliefs and the One Health component. And certainly there's lots of experiences where people believe this is a religious issue and not a scientific issue, and that's something that we have to take into account as we interact with communities, as we create information and teaching material to try and not necessarily oppose or dismiss the beliefs of the communities or the people in the communities where we work with, but to try and work with them to help them get an understanding of what the scientific evidence is and what the reality on the ground is. Now I will ask our speakers to give us final remarks in 1 or 2 minutes, and we move towards concluding the session. I'll start with Jackie. Any last words, any concluding remarks? Thank you.
Very well. Okay, so I'll conclude by saying what a wonderful topic this was today. Very eye-opening in so many aspects. And we have really seen how there are so many intertwined aspects to climate change coming in and trickling into animal health and human health as well. I'll just like to bolster what everyone has just been speaking about, collecting evidence for all that we speak of, because for change to happen, data and evidence must surface. And for that to also be brought to the limelight for all these multisectoral bodies, we need to be able to be transparent, give proper evidence, give proper data, so that all together we can work better for human health. As well, we have talked about a lot of behavioral change that has to happen for the One Health approach, and as well as acting on the climate change crisis. So I would just like to encourage all of us to ensure that youth are always brought to the table when these discussions are being held, such that their norms, their cultural taboos, their cultural perspectives are always put into consideration, as we always try to look for a way forward to incorporate everyone in the One Health approach. Thank you so much for having me. It has been an enlightening discussion.
Thank you. Rahim, any final words, any concluding remarks from you?
Yes, okay. Thank you, Charles. Thank you to all. Yes, I was very happy to contribute to this session. And as of lesson learned, we know the relationship between zoonosis and the human health, and we know the impact of the climate change on the human health. So, but the most important is to know how government can put in place a resilient response that can regroup all concerned sectors, especially the climate change sector. And so it can be concluded that it's possible to make interoperability between people and processes, and even from different sectors, in order to achieve efficient results in the response to the disease that affect the world today. And the COVID-19 pandemic reminds us that the need of this multisectorial approach is very evident. So thank you.
Thank you, Rahim. And finally, Barbara.
What an honor to speak with you, Charles, and to be with you on this panel, Rahim and Jackie, and also Simon. Thank you for embodying what we're all talking about, which is bringing in youth voices. And we have so much to learn. From this concluding remark, let me just make 3 important points. The first, this is the time for radical collaboration. This is the time, which is kind of exciting, to really reevaluate how we have been working in our comfortable little silos and areas to reach across those. So radical collaboration, really finding out where and how we can most stretch to get the kind of work we need. And this is pivotal times, you know, time is running out to do the kind of work that we really do need to create the shift for our planet, for our world, for the other species, just as importantly, that share this planet with us. My second point is what the other speakers have also reiterated: evidence, building new trails of evidence. This is the intersectional, the multisectoral approach. If it doesn't exist today, we get to create it. We are the solutionaries. We understand that we all hold just a small piece of the larger puzzle. And these challenges, the pandemic, as Rahim just mentioned, this climate change challenge for our world, they ask us to dig deep and to be able to reach across those silos, collaborate, and build evidence platforms that are much more attuned to how people actually live their lives. No one lives a one-issue life. We live all of these issues at different times, in different ways, in different frequency and intensity. And it's important that we pay attention. And the third is simply my great gratitude for the voices and the creativity and the ability for us to listen to the youth. It's no mistake that our world is filled with a presence of a generation coming that really asks us to wipe away some of our old rigid categories. This is the time where all of us, with a little bit more empathy and humility, can understand that while expertise is required, so too is deference in understanding that there are innovators and creators coming through with new technologies, new ways of working, where we can actually learn. And we journey alongside all of this. Radical collaboration, unified evidence, and solutionaries across all ages, but certainly with welcoming more and more the youth of today and tomorrow. Thank you so much for the honor to be part of this panel.
Thank you very much. Again, thank you very much, everyone, for joining. Thank you to our speakers for sharing your insights on the issue. And just a reminder that we will have a break for maybe 8 or so minutes, but do feel free to join the plenary at 12:30, and the link to the plenary is in the chat. Thank you very much, everyone, and we wish you a successful rest of the conference. Bye-bye.
Thank you, Charles.
Thank you, Charles. Thank you, Barbara. Thank you, Jacqueline.
Thank you all.
Thank you, everyone.